Hey guys, welcome back to my channel. I know it has been a really long time since I last posted a video, and for that, please forgive me. However, I'm back with a new video, so if you haven't already, please make sure to like this video, subscribe to my channel, and comment down below. All right, let's get started. So today I'm going to be talking about Alzheimer's disease. I'm sure a lot of you know about Alzheimer's, but today we will be going into a little bit more depth about information that not many people know enough about. This information could be very necessary when it comes to Alzheimer's. So, what is Alzheimer's? Alzheimer's is a neurodegenerative progressive disease where nerve cells in the brain die. And it's the most common form of dementia. It results in many different behaviors, such as impairment of the memory, thinking, behavior, judgment, and communication, and thought processes that involve visual and spatial awareness. It could result in confusion, restlessness, personality or behavior changes, inability to follow directions, language deterioration, and emotional empathy. Alzheimer's affects about 5.2 million Americans above 65 years old, and it also affects hundreds of thousands under 65 years old. 2/3 of the affected Americans are women. So what is the difference between Alzheimer's and other dementias? Well, the characteristic changes of a brain affected by Alzheimer's are only visible under a microscope during autopsy, where that isn't the case for other dementias. Alzheimer's shows the presence of the following: neurofibrillary tangles, which are fiber tangles within nerve cells, and it also has neuritic plaques, which are clusters of degenerating nerve endings. Alzheimer's results in the reduced production of certain neurotransmitters, such as acetylcholine, which is necessary for the contraction of muscles, norepinephrine, serotonin, and somatostatin. Alzheimer's does not affect the patient's motor functions until the late stages. However, other dementias may do it a bit earlier on. So as you can see here, this is an image of the healthy brain, and then this is an image of a person affected by mild Alzheimer's disease. And this is the brain of a person who is affected by a severe Alzheimer's disease. As you can see, the healthy brain has a lot more surface area to it, but the severe Alzheimer's disease, the surface area of the brain is a lot less. And this is caused by the neurodegeneration in the brain, and that causes memory loss and inability to function, to do certain functions. So, what causes Alzheimer's? Scientists do not actually fully understand the causes, but they do suspect certain causes, such as age and family history, certain genes, abnormal protein deposits in the brain, and other risk and environmental factors, and immune system problems, such as it could be an autoimmune disease that could cause Alzheimer's. So some warning signs to let you know that you or someone else has Alzheimer's are changes in short-term memory that may disrupt daily life, such as forgetting some words or names, how to get to a familiar location, cooking, and paying the bills. So some of the most common symptoms for Alzheimer's are memory loss that affects job skills, difficulty performing familiar tasks, language problems, disorientation to time and place, poor or diseased judgment, problems with abstract thinking, misplacing things, changes in mood, behavior, or personality, and the loss of initiative and the ability to recognize who people are, even people who you're familiar with when the disease progresses to a severe stage. Note that some of these problems may not actually be Alzheimer's, for example, misplacing things. If it's not frequent, like very, very frequent to the point where it is a warning sign, like a red light that says you have to get it checked out, you probably don't have Alzheimer's. So some of these may look like you have Alzheimer's, such as misplacing things or language problems, but they also may not have anything to do with Alzheimer's. So that's why make sure you always get it checked out with a doctor or your healthcare provider before you take any medicine or you decide to do anything after that. So for diagnosis, the doctors do not have a single test to diagnose someone with Alzheimer's, but specialists can rule out other similar conditions and diagnose a patient with Alzheimer's with about a 95% accuracy, but there's only confirmation through autopsy. So there are a few different diagnostic procedures, such as a mental status test, which is a brief and simple test of memory and other common cognitive or thinking skills. And this test is usually a part of a complete neurological exam. There is neuropsychological testing, which looks at how the health of the brain affects thinking skills and behavior. You could also have a blood test taken. You could have a lumbar puncture, also known as a spinal tap, which is a procedure that is done by inserting a hollow needle into the lumbar spine, which is the middle back, well, lower back, actually, lower back. There is a urinalysis, which is a laboratory examination of urine for various cells and chemicals, such as red blood cells, white blood cells, infections, and excessive protein deposits. They can take a chest x-ray, and they can also take an electroencephalogram, which is an EEG, which is a procedure that records the brain's continuous electrical activity by the means of electrodes attached to the scalp. There is a computed tomography scan that doctors do, which is also referred to as a CT scan or CAT scan. I discussed this in my previous video, but for those who don't know what it is a diagnostic imaging procedure that uses a combination of x-rays and computer technology to produce slices, which are horizontal or axial images of the body. And it shows detailed images of any part of the body, and it's more detailed than x-rays. In this case, we do it for the brain. Again, in my last video, I also went over magnetic resonance imaging, which is also known as an MRI. And for those who don't know what it is a diagnostic procedure that uses large magnets, radio frequencies, and a computer to produce detailed images of organs and structures within the body. In this case, it would be the brain, so that they could look at it and determine whether you have Alzheimer's or not. Last but not least, there is genetic testing, which is available in research settings, but do take note that the decision to undergo genetic testing requires careful consideration and counseling with a specialist in genetics. So how do we treat Alzheimer's? Unfortunately, there is no cure for Alzheimer's. Why? Because Alzheimer's progresses as nerve cells in the brain are damaged and cannot function normally. Nerve cells are the kind of cells that cannot reproduce. So once they die, they are dead for good. So if nerve cells are damaged and cannot function normally, you are losing nerve cells, and that is not a good sign. And because it progresses as nerve cells are damaged and cannot function normally, and you cannot bring them back to where they are, there is no way to reverse the damage. So the most important way to treat Alzheimer's is by managing it, such as using physical exercise, social activities, proper nutrition, health maintenance, and having a calm and well-structured environment. Medication can sometimes help with cognitive and behavioral symptoms, but the treatment is based on many factors, such as age, overall health, medical history, the extent of the disease, whether it's mild Alzheimer's or severe Alzheimer's, tolerance for specific medications, procedures, or therapies, expectations for the course of the disease, and last but not least, your opinion or preference. Currently, there is no cure, no way of slowing the progression, and no treatment to reverse the damage. I know that sounds very dark and hopeless. However, there is still hope because there is new research that is underway. Drugs are being studied in clinical trials to see if they can slow the progression or improve the memory for some times, therefore prolonging the development of Alzheimer's. There is medication to deal with the most troubling symptoms such as depression, behavioral disturbances, and sleeplessness. Well, thank you so much for watching this video. Like I said at the beginning, please make sure to like this video, subscribe to my channel, and comment down below. And I will see you next time.